Hi,
Hi, Stephanie. Nice to meet you. I'm Shrila.
nice to meet you. I've heard so many wonderful things about you.
Oh, thanks. So I know I'm in Jacksonville, but excited to chat with you about your project.
Well, I just saw did you put an advertisement or information about your study in the newsletter, the research
Mhm.
newsletter? I just saw that, but it sounds really interesting.
Thank you. Yeah. So you're submitting in June, is that right?
Y- Yep,
Okay.
yep. T minus like just under 2 months.
Yeah. Plenty of time. You're in good shape.
Hi, sorry I'm late. Well,
You're
almost
not
late.
late. Yep.
I'm just early.
Just early. How are you?
Doing good. I'm glad I got to join. So I'm in Seattle right
Yeah.
now, so I'm 3 hours behind.
Got
But
it.
it worked out. So
I'm so glad you're able to join. Thank you so much. Yeah,
yeah, of course.
I think we're waiting on a couple more. I was just in a meeting with Melissa Alderfer, who will be facilitating this discussion, so she'll be joining shortly, I'm sure. Here she is. Hello.
Hi, folks. Sorry to be muted and sorry to be late. Um, Thanks everybody for being here. Julianne might have explained we were in a different meeting, so that's where we were. What I'm hoping today is this could be pretty informal. I'm hoping that everybody has had a chance to look through Stephanie's materials, and what we can just do. If Stephanie, if you have something that you want to say in advance of folks giving some comments of the materials, that would be fine. If you have any preferences for how to go through this, like if you want comments specifically on like the bio sketch first and have everybody share those and then move on to the other sections, however you feel that this information would be most useful to you, I want you to give a chance to kind of put that on the table first.
Yeah, I think this work in general, and I know some of you were part of the first MAC last year, is building on my COBRI research for sickle cell, and is was going to go in the fall, but because of some suggestions that I got, I reworked it and am now submitting in June. So it kind of builds upon work I've already done and is that's the target. I think, however, I do not have any agenda. I just really appreciate everybody's comments and time, and look forward to hearing about it.
Great. Well, who would like to go first in starting the review process?
I'm just going to chime in and say I think Anne Marie wanted to go last. She hasn't joined yet today, but she asked if she could go last.
Okay, that's convenient.
I haven't done a Mac session, but it's my first time. But I'd be happy to share first. Also, I don't know, did everyone also review like the career development plan, or was that just me? Okay.
And Anne Marie did as well.
Okay, perfect. I
I
just wasn't
didn't
sure because I knew that came in later. So
Yes, yeah.
I didn't see that one, the I saw the one in the fall, but I don't think I got a version for this round. But maybe I'm happy to take a peek at it. Was it on the most recent email?
I
I
think
know.
Aaron sent it to me separately, if I remember correctly,
Okay.
but yeah.
That's okay. I had a couple questions about that, but I'll save them for when I'm up and can ask them.
I guess I can just go in order. I'll start with the bio sketch and then go into the aims, research strategy and approach, and then end with the career development plan, if that's okay. Okay, awesome. All right. So first of all, you've done a lot. Very impressive work there. And I wanted to give just a quick background on what I do so that you can understand the lens that I have too on this. So I'm in my third year of my K-23, and I'm a clinical psychologist by training, and I do focus on pain and pain management in adolescents and young adults. So that's kind of my background. So the first comment I had is, and so you'll notice that some of it is a little bit more pain focused because that's just my area of expertise. So I felt most comfortable addressing some of that. In your first section there of the personal statement, after reading your proposed project, it does have a large pain focus, but I didn't really see your experience or expertise in that area highlighted in the personal statement. So maybe just adding a little bit of that in there, just so it kind of meshes well with what the reviewers are going to see moving forward. Same with the, you mentioned stigma and racism, but when we get to the candidate statement, I think that can be boosted up a little bit. So just making sure those two kind of fall in line with each other so that there's kind of no surprises, I guess, when they get to that point. But otherwise, like, it looks really great. I think you did a fantastic job of highlighting all of your contributions to science and giving some of those examples underneath each section. So I didn't have too much on the bio sketch, so I'll just move on from there to the aims. And please feel free to interrupt me if you have a question about something that I mentioned. And so again, with the aims, overall impressions, really nice job. I encourage you to think about what the key information is that you want to convey. There's a little bit of redundancy or ideas that are introduced that don't seem like they're central to your aims. That may not be true, but for example, pain catastrophizing is mentioned once, but I believe that is kind of central to some of your outcomes later on. So I know there's very little space to convey your main message and kind of hook the reviewers, but you want to make the most of it. So I kind of think of it as like, each idea presented really needs to lead the reviewers to your aims and relay the innovation and significance of your proposed project. And I'm happy to talk further with you. I made some other comments throughout that I'm happy to send to you and meet with you later if that's helpful too. I don't want to take up all the time. So but just certain things like making sure there's just some consistency of if something's mentioned that it actually comes up later, and moving kind of into, like, I was always told, kind of like a funnel of, this is the main information that we have, the gaps, and then moving into how you're going to address that through your project. And just kind of making sure when you mention, like in your career development goals little section there, the part of deepening your mentorship relationships, obviously very important, but it doesn't tell me much about how it'll directly impact your professional development. So perhaps you can state something more directly about how the mentoring relationships will help you develop or strengthen skills instead. So it's a little bit more specific to you rather than kind of the broader, deepening of the relationships. So getting into the aims, and some of this just may be clarity for me too. It's a little unclear to me kind of what the main goal is. It almost seems like there's like three separate ideas, and I was having trouble seeing a little bit of the synergy among the aims. And so what I mean by that is, in the first aim, you're proposing to develop and validate a tool. And the second one is using, data that already exists, but I'm curious if you could actually gather that data in the first aim, or what that larger database adds basically above and beyond what you would get out of the first aim. And again, I'm not familiar with the cardiovascular risk factors and adults data sets, so maybe you can speak to that a little bit. And then going into the third aim, there's a lot of pieces to this, which is great, but it's hard to kind of follow, like, is the focus nutrition? Is it how nutrition affects pain management. Is it just pain management? Those kind of pieces. And I have a little bit more within the research strategy that I can speak to. But I wanted to pause there, first of all, because I feel like I'm talking a lot, and see if you had anything that you wanted to address.
Yeah, so I think, it is kind of hard to put all this together. So like what we did in the work that I've done is look at how experiences of stigma and racism affect self-efficacy and pain catastrophizing, like from this existing database, the IMPORT database, which is quite important in sickle cell. And then we found that pain catastrophizing and self-efficacy could be a target to improve kind of mental health symptoms and functioning. And so and then we have done some mixed methods interviews to understand our patients' experiences with these sorts of topics, with self-efficacy, with stigma, and then kind of moved into the pain management piece of things, chronic pain versus acute pain, how all of these things influence it, and kind of the ultimate goal is to have this peer-mediated curriculum to be administered by trained people with sickle cell disease and given to adults with chronic pain to improve their self-efficacy and pain catastrophizing, with the end goal of improving healthcare utilization and all of those things we want to do. And then kind of in moving towards that, and we looked at the curriculum in the first set of research and made it sickle cell specific and vetted it with the community multiple times. And so the curriculum that we have now is truly something that's patient informed and based off of their experience. But in asking them kind of like, what else do you want to know about? This idea of self-care behaviors and nutrition in particular came up, and they said, we want to know more about nutrition. But if you look in the literature, we don't know what to teach people about nutrition in sickle cell disease. And, we don't know what self-care behaviors are important in sickle cell disease and how that you should be incorporated. And so the idea was kind of to take a step back in the K and figure out like what specifically should we know or is important about nutrition and sickle cell disease, self-care behaviors, and how can we then incorporate that into this curriculum to make it meaningful and valid and useful as we're teaching people to manage their chronic pain in all these non-pharmacologic ways. And so the AIM-2 is something that I think, Alyssa, you will recall we spoke about a lot the first time around. And I think, we nutrition as a self-care behavior in sickle cell disease and kind of what to teach people is the idea behind that aim. And so certainly, yes, I can collect more data from my own patients. One of the pieces of advice I had gotten, and I would be curious to know your opinion on this group, was just like from a grantsmanship perspective. Oftentimes the K wants you to demonstrate acquiring new skills, such as analyzing a database that already exists, and kind of that was what this aim would get us. But I guess the question is, can I change it? Can I tie it in better to make it fit more, or is it still too tangential?
That's a great question, and thank you for explaining it. I think that helps give a little bit more context, since I'm probably one of the ones who this is the first time I'm like reading this. So just knowing the background is helpful. I think that is a great point, that if that is one of your career development kind of training gaps that you're wanting to fill, maybe just making that a little bit more clear. My main thing was, what value is being added by doing this, and kind of above and beyond what your first aim is covering, because as a reviewer, my first question would be like, oh, how is this different from AIM-1 other than being a large data set? Like, what is it adding? And I think it makes sense, like from a professional development standpoint, but also as you're saying, like, you could do this in your own patients, but also getting maybe a more generalizable sample that has been collected. So maybe just making that clearer. I don't think you need to get rid of the AIM. It's more just underscoring, why is it valuable to have it, and how does it align with your professional and the scientific goals that you're
Okay.
talking about, if that makes sense.
Yeah. Yep.
Yeah. So yeah, that's kind of the main thing, is just kind of with the aims stringing together. They seem just a little disjointed right now, just to me. And because especially with the peer group intervention, I'm not sure if it's focused on more of the stigma reduction, pain, a combination of those things, nutrition, what exactly. It's kind of difficult to follow the reasoning just a little bit, as each of those aims could be a standalone investigation. So just making it a little clearer of the synergy of like how they're obviously not dependent on each other, but informing each other, right? So they're great at not being dependent. So that's awesome, because that happens a lot where they kind of depend on each other, and that's a problem, as you know. But just kind of seeing how it all comes together as you're reading, like that flow of what you're trying to accomplish. And then just clarifying in AIM-1, what is being developed? Is it a survey, a tool, the same, like a survey and a tool? And how in your research strategy, how it's being developed. I know you mentioned there's 10 items, but I'm not quite sure where you're anticipating that's coming from. Is it something you've already designed? That sort of thing.
Okay. So, sorry, do you want to, I don't know whether to keep listening or
Please feel, like I said, just
Okay.
interrupt. It's a conversation, so whatever's helpful to you.
Okay. So in the import data set, which was done at Hopkins and Howard, they did a sickle cell self-care behavior survey that was 6 questions that they just made up. And we, in our second sets of mixed methods interviews, have done some like cognitive interviewing about themes for self-care behaviors, and figured out like what else we should incorporate. So the idea would be to take that survey that they just made up, to add the items and the themes that we got from, not just made up, but like, hasn't been validated.
Yes.
And then to add the themes and the questions that we discovered, through our prior work, and then kind of put it all together and make it a validated tool.
Yeah. Perfect. Just say that. So just add that in, because I was like, are these questions that exist, or just kind of filling that gap for them, of like, okay, this is what's been done. These two things, we're combining it so that we can validate it. So just a little bit of how it's being developed is helpful to know. And explaining just a little bit more about what that cardiovascular risk factors and adults database is, kind of where it comes from, what are measures that are found in it. You mentioned self-efficacy, self-care, nutrition knowledge, pain catastrophizing. So some of the things that apply to all of these are, A, how are they being measured? Or how were they measured if it's from a database? How exactly are you going to, when you get to like the feasibility and acceptability piece, how are you measuring that? And I'm pretty sure since it is feasibility and acceptability, there's no control or comparison group. So just making that, that it's a single arm sort of thing, clear, so that there's no questions about that. And maybe if how long you're anticipating you would want this group to last, or how many modules you see happening, would be good too. So just a little bit more defining what you anticipate this group intervention would look like. And again, like kind of what the role of the pain piece is too. It's a focus, but it doesn't always appear as a main outcome in some of what I was reading. So just keeping that a little consistent, since I know you're balancing a lot of different outcomes and variables. And so just kind of making it consistent throughout, of which part is measuring what. And I know you had a little box of the curriculum elements that you had included in your, I think, approach section. And I don't know if you're planning on kind of discussing that a little bit more, or, just giving a brief mention of things. Like I'm not sure if it's clear, kind of like things like where is stigma going to fit in? Like it's in the box, like how is it being addressed, or how do
Okay.
you, what kind of questions might you be asking your participants to get a better idea of that lived experience piece that
Yeah.
you're talking about too. And nutrition stands out a lot, but it's the other pieces that were obviously important outcomes for you, but didn't really come up as much, like especially when you were talking about like the background section. So
Okay. Okay.
and then with the pain piece, what specifically do you think you might do to address pain management? So for example, like how might the groups address pain catastrophizing, or is there something you have in mind for what would actually be part of that intervention piece of how are we addressing pain management through that? So that's kind
Can
of
I
in a
just
nutshell. I want to make sure I keep time for everyone else, and I'll get to the career development piece real quick too. But
I was just going to clarify too, because this came up. This is actually so helpful to have someone new, because I was reading it. I was like, oh, it makes so much more sense after we went through last time. But like having fresh eyes, because this is exactly what came up in the fall with like the nutrition. And I did just want to clarify, this is an already existing like CBT based curriculum that you're adapting. Is that right? Yeah.
Yes.
That came up last time too, as like we didn't know that until you explained it. So in
Okay.
case that helps to answer the question you had of like, what is this curriculum?
Yeah.
It was based on like evidence-based cognitive behavioral strategies, it sounds like, for pain. And really what you're doing is adapting it based on the needs you're hearing from the sickle cell community around self-care and nutrition.
Yes.
perfect. So that is very, very helpful. So yeah, as any reviewer, that they're not going to have that background from you,
Yeah.
unfortunately. So I'm glad I'm able to give that perspective. But yeah, as long as you just, give that reference of like, that's what you're adapting, are there certain pieces of it that you're adapting for this, and the fact that it's already something that's evidence-based, then that question of, are you creating a new intervention doesn't come up, where you have to explain all of that. So I think that'll be helpful background to have. And then just defining, like in the pain world, pain catastrophizing is used a lot, but I have colleagues outside who are like, what is that?
Yeah.
And so just defining, what does that mean? Making sure not to conflate it with things like depression and anxiety. Those are
Yep.
not the same. So
Yep.
just having that defined a little specifically would be helpful, since that's one of your main goals. All
So
right.
can I just
Mhm.
ask a question?
Yeah.
In the first set of interviews, we asked participants to rate the modules that currently exist in terms of, like it, hate it, don't really care,
Mhm.
in obviously more scientific ways. But that sort of data, I imagine, would be helpful, along with maybe a brief summary of the modules. Yes. Okay.
Absolutely. Because if it's guiding your selection of the modules, I would want to know, like, did you just
Okay.
draw them out of a hat, or did you, what did you do? And you did a lot of work to figure that out. So I
Okay.
think that is definitely pilot data, even if it's more qualitative or anything, like something to still speak to. Okay, and so
Okay.
I'll just quickly go into the career development. I'm aware you're not done with it, so with that caveat in mind, just a few things. What I was told a lot is don't be afraid to toot your own horn. And so you've done a lot, so we really want you to put that out there. My main thing would be to emphasize more of your specific skills and research experiences or findings that are unique to you. Like, what are you kind of bringing to the table, as well as the training gaps that we're talking about. So what are you hoping to fulfill through the support of the K-23? So it's weird because they want to know that they're supporting a promising early career investigator, which you are. So you want to show them that like pretty easily, so they can just kind of see it and be like, oh yeah, like you have kind of the requisite skills that you would need to be able to successfully complete this, but that also you're recognizing these are some of the areas you want to fulfill in terms of training gaps, and that you can really only do it with a K-23, and that's why it's so specific to you being able to reach these goals. And then, as I know you're still working on kind of the specific mentors piece, but just making it very clear, like I know you have some collaborators, I think, too, and like who's a mentor versus a collaborator, what are their specific contributions to your training objectives, and just making those training objectives a little bit more specific. So right now, I want to hear more about you as a researcher. So, like, what is your previous experience that shows kind of your dedication to science? But what are also some of the strengths that you have and areas of growth that each of those mentors could help fulfill for you or with you? And just kind of being careful to make it clear that they each have a specific role, because that was my first submission. There was a little bit more overlap with one of the mentors with another one. So in my resubmission, I actually selected a totally new mentor, which I think helped a lot because it showed the unique contributions that each of them could have. And as you're kind of working on this further, we can chat more about that too. But just with what you have so far, those were kind of the main things that stood out.
Okay. Yeah, there's 3 mentors. Sophie Lanscron, who was at Hopkins and will be moving to Jefferson, who's the like sickle, I know, right? Cool. The sickle cell adult research mentor piece. David Brousseau, who's the like Nemours research primary mentor who does health systems research in these sorts of large studies, and then Kim Cantor from the Center for Healthcare Delivery Science at Nemours, who does the tool development and design thinking piece of things. And then the collaborators, I'll clarify what they all do. I've worked with all of them before, so this is all a continuation of work that we've done prior. So that's helpful.
Right, great. Thank you.
So we're going to have Emery go next.
Thank you. Sorry. I clearly was driving. Now I'm sitting on car line. This was unexpected. This would have been the ideal time, but now I'm actually sitting here waiting. But I'm car number 4, which is never. Okay. Because I left early to get there. Hi, Steph. You're amazing. Hi. Hi, Alyssa. Nice to meet you. Anne Marie and Shrila. Nice to meet you. I know the other people. So, of course, I agree with everything you said, Shrila. And then, Steph, of course, this is not my area of expertise at all. I'm a pediatric rheumatologist for Alyssa and Shrila. But so I have some more big picture things to go over. And I will send you this.
Great.
Yeah, there's lots of comments in the side. So there were a couple of things. I'm not used to seeing aims written that way, that you say hypothesis 1A. So if you read hypothesis 1A, that's not a hypothesis, right? Many of your other things, you state what you're going to do. That's an aim or a sub aim, but it's not a hypothesis. There's no, like, aim 1B is a hypothesis. You've written it like, I hypothesize that the participants will have lower self-care behavior, will have higher symptoms and pain catastrophizing. But 1A, you're stating what you're going to do using exploratory factor analysis we will develop. And so I think what I'm used to seeing is the aim, which you have lovely aims, then a rationale or hypothesis for that aim, and then your tasks, which might just be labeled as A and B, or sub aim A and sub aim 1A, sub aim 1B, but they're not hypotheses. I know that's splitting hairs, I'm sorry. For aim 2, and people correct me if you think I'm wrong, the word examine might have gone out of fashion, and they want a little more, like, they want a stronger word with a deliverable, right? So examine or explore are no longer trendy, and words more like, which I wrote down a couple of, like define, delineate, identify. Like those tell them there's going to be a concrete deliverable as opposed to examine. Like I might examine the inside of my car right now, but there's not going to be a deliverable. You know what I mean? As opposed to define or something stronger, demonstrate, divine, something like that. I am a very simple thinker. So I was like, okay, aim one, develop and validate a tool. Okay. I agree with what Srila said. I was looking for more details on how you were going to develop that tool. So
Okay.
when there's there in the approach, you can do that. Aim two, I was fine with, you know, like, yeah, it's nutritional needs. Thought that was good. And then three, develop and pilot a chronic pain curriculum to be used in these peer mediated groups. We definitely spell out what you have to create de novo and what you're going to um, create from this, or what you're going to adapt for this. Because when you think about the K philosophically, it has to be good science, right? Of course. But more importantly, will this make Dr. Guarino a successfully independently funded, hopefully NIH is what they want, researcher in the future. And so the science, of course, has to be A plus, but the science as a tool to allow you to develop into a successful, independently funded researcher is the most important part. So you really have to show, because they could look at this and, you know, developing a tool, validating it, then examining nutrition, and also developing the curriculum and piloting. That seems like an awful lot for 5 years. So you really have to make sure it's clear to them what your foundation is already, and you just have to take it. You don't have to take it from here to here. You have to take it. You're starting here and going up to here. Yeah, just make that clear, so that they're like, yeah, you know what? This is a very reasonable, doable 5-year project. Oh, and it will help develop this researcher into a successfully funded independent researcher. I have some other little highlights of sentence structure that are irrelevant right now, and I will send them to you as a copy, and you can take them or laugh at them, whatever you want to do. Now, under innovation, paragraph B3 was like the piece de resistance. That entire paragraph, I'm just saying it out loud, even though I wrote it here for you. The entire paragraph is excellent. So that is B3 under innovation. It drives home both the innovation and the contributions of the project, and it stresses that it's patient centered. So I love, love, love that paragraph. And I think it really, really hits home. Um, Later, under the approach C, I just put you need the description of the development of the tool. Then, after you say how you're going to administer the instrument via red cap on an secure iPad, you said select participants. How will they be selected? Someone's going to say you didn't say that, unless you have it somewhere else and I missed it. But you get, that's the kind, even if it's a half a sentence, those are the kind of picky things that, and if one reviewer starts down that, like, well, she didn't say how they're, all of a sudden your discussion gets derailed. You know what I'm saying?
Yep.
So you want to anticipate anything that someone could say, I don't understand that piece, and you want to anticipate it and head it off in the beginning. Okay. Ah, then the very last thing that was very smart that you put that C5, future independent fun, funding. You did start the sentence with after 5 years. No, no, they want you to say in year 3 to 4 of this K23 work, I will submit an RO1. So that's the one grant where you can overlap, right? You can have the last year and a half of your K. Correct me if someone thinks this is wrong. You can if you suddenly or miraculously get your RO1 or R21 or whatever on the first submission, you can overlap it with your K. So they want you to say that today, when you put in this K, you're already anticipating when you're going to put in your independently funded project. So I would change that from after 5 years to in years 3 to 4, I will be submitting my very intentional, impactful RO1 on this work. Okay. All right. Thank you. And then I will definitely send you this
Okay.
and the career development and bio sketch I will send you. I really didn't have very much on them, but I
Okay.
will just send them as a copy. Okay.
Thank you.
Thank you. I'm so sorry. Is there anything you wanted to ask? Anything that didn't make sense?
No, I just think it's interesting to hear how you structure things because to be honest, the way that this was done was built a lot off the Cobri, which was highly influenced by Andy Kolb and the consultant that we paid to put this all together. So I just think it's interesting how many different kind of ways you can put all this information together. But what you're saying makes sense for this.
Okay. Thank you. Thank you for letting me read it.
Thanks, Anne Marie. Alyssa?
It's good to see you again. Like I said, it was so neat to like read it again, having all that conversation and context and like knowledge going in. And so I'm a pediatric psychologist. I specialize in sickle cell disease, and I've had my hands in several different things. Pain, quality of life, and neurologic complications are the big ones. So yeah, it was interesting kind of diving back into this. And obviously I knew in advance that like this was an existing curriculum, you were adapting it.
Right.
And the innovative pieces were that, you were using patient feedback to tailor this, including both the self-care nutrition piece and the peer-mediated intervention. And that those were really like the most innovative components, right? We're making this very sickle cell specific. I think that on the aims, one thing I realized is maybe instead of saying develop in aim 3, that should be adapt, right? Because you're not developing from scratch, you're
Yeah.
adapting. And so maybe really strengthening the curriculum you're already using. So that takes away that reviewer question to begin with. So you're adapting, this evidence-based set of, CBT strategies, to be tailored to the specific needs of patients with sickle cell, including self-care nutrition and via this peer-mediated intervention. I think that would go a long way, particularly for the rest of the study section that's not going to see the research strategy.
Okay.
That will be really helpful for them too, and for the presenters. And that way they're not going into the research strategy being like, are you developing or adapting?
Okay.
Are you using like a specific framework for the adaptation? Like I know there's like, and I'm not an expert in this, but I know in another study I'm in, they're using like the re-aim framework. Are you using a specific framework for adapting the
Uh,
intervention?
um, no, I don't know. Maybe yes. Maybe it seems like I should. Is that the right answer? No, I think one of the and Kim is not available currently. She's on
Yeah.
maternity leave, and so
Oh,
a little bit of some of my like, where I just say insert design method like strategy, that was just because I'm going to do a draft on my own, but waiting to talk to her. So,
oh,
I do think that was one of the
yeah.
questions was, is there more specific, like how do you measure some of these things? Is there more like a scientific way to go through it? So that's actually quite helpful.
Yeah, yeah. So I'm part of another study. So I work with Shannon Phillips over at MUSC, and she has an R01. She's lovely. That's a self-management digital intervention, and she's very familiar with like the re-aim framework. There are
Okay.
also a lot of like existing like feasibility tools and things like that that are out there. I wish I was the expert there. I'm helping her on her study. But Kim should have that expertise too.
Okay.
But thinking about that, because that is such a big part of what you're doing here is adapting an intervention. And you already have a lot of data though that's informing that adaptation. So that's where I think, yeah, talking with her or in her absence, if she has a good contact, I know like
Yeah.
she works closely with Lori Crosby, for example, or someone else who can give you that expertise of like a framework. That's a really hard position to be in. But yeah, so tailoring that language a little bit more, like you're
Okay.
adapting, building in a framework to support that.
Okay.
And then I think, this came up in the fall, and I think it's still a question with that second aim of, I know we talked about in the fall whether whether that should be an aim or whether it's just part of your career development. And I think the only challenge I'm having is like, I think that what is so innovative about this is your adaptation of this intervention. And I really want that to shine in the aims and for people to really get that. And I'm just not sure if the two above it might detract from that. But I get that the nutrition piece is so important. There's a lot we don't know. And I think that's where we got stuck in the fall too. But just thinking about that, just like really making sure that that aim 3 is clear, I really think that's going to stand out to people. And that's what's so neat about this, that you're listening to the community, you're doing what they want. And then, and I'm assuming Kim is going to serve as like the mentor for like the design thinking
Yep.
piece.
Yeah.
I was debating, I feel like design thinking could be its own, it's like its own thing to explain. And so I was debating in my head, like, is that going to detract reviewers a little bit too? And then what are they expecting to see now that you've brought up design thinking? I think that it's innovative in and of itself, and you may use design thinking along the way. I'm not sure how much I would emphasize that because I think people might get distracted by it a
Okay.
little bit. Whereas I think you want them to really attend to like, this is peer mediated, right? Listening to the community, we're adding these self-care tool pieces. Or if you do want to emphasize design thinking, I don't know, it feels like a lot. That's the only thing I'm thinking in my mind is like, now we've got nutrition, self-care, we've got design thinking, peer mediated. It's just a lot of components to like help people through.
I mean, is it like, do I have to have 3 aims if they're so big? Can I get rid
No,
of aim 2 and
yeah,
just, I think aim 1 is different enough and like a skill set and fills a need that, there's a good
yeah,
reason to keep that, but either break apart aim 3 or just emphasize it more because you're right, there is a lot in it
yeah.
to do.
And it seems like like that aim 3 is where like so much of your like innovation
Yeah.
is driven, where I think people would really like, oh, that's really like that was my impression in the fall when you explained. I was like, that is so cool. That was the piece that I really latched on to that I can see is like missing in sickle cell. But yeah,
Mhm.
I think if you removed aim 2 and just could see what it looked like, does it allow you a little bit more space to then talk about these different pieces of innovation, that you're tailoring it with the self-care nutrition piece, you're tailoring it because it's peer mediated. And then you might have the space too to say, and we're using these design thinking principles and just expand that out a little bit.
Okay.
Just something to think about. I think
Yeah.
like ideally, because this is Kim's area too, I'm like, oh, the design thinking piece. So hopefully she'll be able to help with that or lead you to someone else like Lori, who has that expertise. Let's see. And then I think that was my biggest thing just on the Ames page. And really after it was hard because I already had so much knowledge about the grant. And then let's see, let me look at the research. I had the same comment about measurement. I also wondered if you have someone skilled in measurement development on your team or like a consultant.
So Kim has done that
Kim,
as
good,
well. So that was going to be
great.
her other role. Yeah.
Excellent. And I think when you're talking about that background, I had the same question about like where the items come from and things like that.
Sure.
Really boosting that, you might look at a few example. I can send you some too of like measure development papers where usually they have like a panel of experts.
Yeah.
They've reviewed other, tools that are similar and just making sure that, because you do have experts that are in sickle cell that are, they didn't pull out of thin air, right? Like they
Yeah.
are using their expertise. If you have any existing data on how those initial 6 items perform
Hmm.
too, all of that will really boost up that section nicely. Um, let's see. And then Yeah, I think the only other thing was just I was just trying to make sure like and I had forgotten that Kim was one of your primary mentors, but yeah, just making sure there was someone like really skilled with design thinking and like intervention development. She'll be great. And then yeah, and if she's your expert on measurement, even better, making sure that's super clear in your career development plan when you're describing your mentors and how they're going to support you. Um, and then the other stuff, I just had like really some tiny stuff that I put in the comments because I was having a hard time explaining the big picture stuff.
Yes.
But I can just go through a couple on the bio sketch. You'll need, and if you have a grants person, they're going to catch this, but you'll need the My Bibliography link
Okay.
in your bio sketch. And I want to say you're only allowed 4 contributions to science. I think one had like 7. And so just narrow it down, highlight your
Okay.
strongest products. So that's super minor. Your grants person's going to catch that. But I just wanted to mention that. And then let me just make sure. I thought I had one more comment. Let me just double check. Oh, in your career development plan. So I know with your career development goals, you really focus on like mixed methods, design thinking, behavioral intervention. It also sounds like you're going to learn a lot about measurement development. And so I think that's another piece that you can highlight, and then it'll be directly tied to that AIM-1. Like
Okay.
that's a really cool skill set to have. I wish I know generally as a psychologist, but I've never developed my own tool. Like that in and of itself is a great skill set to have that you could
Okay.
highlight. But yeah, but outside, I thought like the other comments were great. And I feel like those are the biggest ones of just really making sure that this shines with like how innovative this peer mediated intervention really is.
Thank you.
So any other comments for Stephanie?
So after hearing some of the other feedback too, when you're talking about AIM-3, I was also wondering, like, it has kind of the efficacy component in there too with your second hypothesis. So maybe making it clear that it's kind of is trying to establish like preliminary efficacy or something, and that those are the outcomes that you're going to use to establish that. And I put in just like a thing in the chat of like a possible wording for those actionable words that Anne-Marie brought up of like, I'm going to do this and this is what it's going to do. And I agree, especially if you move the design thinking into more of the methods in your professional development and all that kind of stuff, you could even take that part out and focus more on kind of the novelty of what you're doing with the adaptation of something that's existing.
Okay.
So that was kind of just another thing to add, especially if you do keep it the way it is with the 2 different hypotheses, just making it clear you're really doing 2 different things, right? You're doing the feasibility, acceptability, but also looking at some of that preliminary efficacy of it too.
Yeah, and I was going to say one more thing just along those same lines. You know how you have the impact statement at the bottom of the specific aims page? Sometimes, like you say, this project will develop and validate. You can turn it more into a concrete deliverable, like I was saying, like we at the end of this grant period or whatever, we expect to have a validated tool for this and a curriculum or and a validated or whatever curriculum. Like what will they get out of giving you this protected time and these funds? You can write it that way, whatever way you think works better. It's like impact or like expected outcomes, that kind of thing. And one other thing on the bio sketch, I have to look at it again, but there are very strict rules, but definitely make sure you have the right latest date. So sometimes it hasn't expired yet. Oh, but there's a new form and they want you on that new one. And then you can do all sorts of sneaky things like under the personal statement, you're allowed to, and you have to look at the strictly at the rules, but there's like for um for whatever products, work products that you can, and you could even sneak manuscripts in there if you have too many manuscripts for later, or a patent, or you developed a media thing and you want to have it there. And you can highlight completed grants or ongoing grants, something like that. So look at the rules of the two kinds of things you can sneak under your personal statement. Then the contributions to science, you can have 5 paragraphs, and then under each of the 5 paragraphs, you can have 4 work products. So you want to maximize that. And really, in the paragraph, you're telling. It used to be just list all your manuscripts, right, and have your that bibliography and CBI bibliography at the end. But now it's really like, yeah, okay, I put out these manuscripts, but what are the unifying contributions to science? Like, whatever, in the first part of my career I concentrated on nutritional needs or whatever. My work mostly focuses on adults with sickle cell disease, whatever. Then you have the 4 papers, the manuscripts that go along with that, listed under that heading of contribution to science. Then you go to number 2, you write a whole paragraph kind of selling your worth, like what have I brought to the medical literature or the clinical literature, and then these are the actual products. So it's a little narrative, you know what I mean? I
Yeah.
have to. Yours might be amazingly fabulous. I can't remember. I have
No,
to go look at
no.
it again.
Can I just ask a question? And I honestly can't remember whether I put this in my bio sketch or not, but like, in addition to the sickle cell stuff, I've also done some work on like oncology and bone health and things like that. And so if it is a paragraph already, like, is it okay to leave that in since it's not directly related to this? If it's not, should I put it in because it's more like work products and scientific skill and contribution? Like, how would that play out in your minds?
So you have five sections for the contributions of science. Pick pick the 5 that are most relevant to this project, but you're pretty early career. Like, you probably don't have 7 different, right? And
No.
then you may have to play a little bit of a game saying, "Oh,
Okay.
I can unify these 4 because you can only have 4 under each thing. I can unify these 4 manuscripts under this rubric," right? And so you're really trying to maximize what you can get on there, but it has to have a unifying theme. And of course, Melissa, jump in if I'm saying something wrong. And then if you have room, you still put those other things on bone health. If you've already covered all the things that are most relevant
Okay.
to this project, use your full 5 pages, use your full 5 paragraphs on contribution of science, and definitely make sure your bibliography is up to date and have the
Okay.
link at the bottom. Although I think you're not allowed to have the actual I don't think you're allowed to link out. Like, it shouldn't work, right? Right? Melissa might know this. Where you actually have to they have to copy and paste it, right? You shouldn't be able to link out on something you submit to the NIH.
So you can link out on my bibliography,
And
but you
that's it.
cannot have active links anyplace else. So you have
Yeah,
to
like another
remove all of them.
manuscript to link to PubMed. You can't do that. But it's okay for and whatever. Good. Okay. But I will spend a little more time with your biosketch and see what any suggestions I can make on that.
Okay.
And I'm sure you all have like an excellent grant. I feel like, every institution now, like they will have their grant person who looks, line by line and make sure that's formatted because you don't want it kicked back for some error in a bio sketch. So hopefully there's someone there.
I'm not going to, I'll be quite honest with you, I'm not going to rely on them to do that. I have my doubts. I don't know.
Okay. Oh, okay. Well,
I-
yeah. Well, then definitely, yeah, there are so many rules. Yeah,
Yeah.
have people look at it and look at
Okay.
examples and the rules keep changing, I
Yeah.
feel like every round.
And,
Yeah.
and just to kind of build on a little bit of what Anne-Marie said, you can also talk about a group of papers that have all used the same methodology or something like that, especially if it's a methodology you're going to be
Okay.
using in this grant. So you can combine them in different ways, and therefore you're not emphasizing the topic area so much, but how you collected the data or how you analyze the data or something like that.
Okay.
Oh, and I have one other thing. So I have been on a bunch of NIHK study sections. the sentence it starts out, reviewer number one, every single time. They're per case. This is Dr. Guarino. She is a pediatric hematology oncologist who is very well established. She has 21st authored papers and X number of papers where she's the second author senior. They, believe it or not, they start out with that. And like invariably, even though it shouldn't be that important, and they say that for the K, you don't even need a publication, that is how they start out, because they want to show that you're a productive research investigator already. The other thing that I don't know, I can't remember if you had, and I have to look more closely, I would play up any established relationship you have with the mentors who are proposed. Meaning, this team has worked together. I have worked with so and so for X number of years. These two have collaborated on 4 manuscripts. I have collaborated with these two on this much. You want to play up that this is already a functioning team, that
Okay.
this is not a bunch of people who you scraped together and you just met. It's that
Okay.
this team has successfully been productive together. The kind of things that people kind of bring up.
Okay.
Any remaining comments for Stephanie? Stephanie, do you have any more questions?
No, not right now, based on what we talked about.
Yeah, I think once Kim's back, and can really help kind of shape some of the aspects of this proposal, I think that will be great. Another thing you might want to do in advance is look at the bio sketches that your mentors are giving you. And just making sure that their personal statements are really tailored to your project and focus on your development and also their role as mentors to other people.
Okay.
Great.
I
Well,
I have no other comments. I'll just send my stuff.
Thank
Yeah.
you.
Yep.
I was
If
just going to
everyone
say
wants,
that.
oh, go ahead. I'm sorry.
Sorry, Julianne. I was just going to say that it sounds like everybody has some comments and notes written that they can also forward on to you. And Julianne has made a recording of this session. So if there's anything that you missed that you want to go back and listen to, you can do that as well. Go
Okay.
ahead, Julianne.
Yes, definitely. I was going to say, if everyone wants to send their comments and stuff to me, I'm happy to compile them into one email for Stephanie so that it's all nice and neat for her. But
Perfect.
if you'd rather send it faster, that's totally fine too, directly to her. Either way.
I just wanted to say also, Stephanie, this is really important stuff that you're doing, and I'm really glad that you're going after this. And just a little plug, I think we should collaborate
I do.
at some point
I think so
too.
too.
There's not enough of us doing that kind of, especially the pain piece of it too. It's like largely ignored, unfortunately, especially with sickle cell, which would be a new area for me. But I also want to say you had asked, or there was that question about like the biosketch and the sections, and you did have a part about some of the AYA related stuff you've done. And I think it really highlights how what you talk about in your career development plan of the lifespan perspective. So I think it's perfectly makes sense to keep that in and really boost that up too, of showing kind of the breadth of knowledge and experience that you've had. So just wanted to throw that in there as well.
No, thanks.
Yeah. All right.
All
Excellent
right,
stuff.
folks.
It's fabulous.
Thank you.
Erin or Julianne, anything else we need to do before we kind of close up today?
I can't think of
I
anything.
don't think so. Just
want
yeah,
to say
just want to
thank
thank
you.
everyone for their
Yeah.
time.
Yeah,
Absolutely.
exactly.
Yeah.
Yeah, we value your time. We know you all are very, very busy people, and we appreciate it.
Yes, thanks very much, everybody. And I hope you have a great rest of your day.
You too.
You too. Take care.
Thank you. Bye.
Bye-bye.
Bye.